Maternal Newborn Breastfeeding Review Quiz with Rationales. Question 1. A client who is in the second trimester of pregnancy gestation. The client is receiving magnesium sulfate tells the nurse that she has developed a reddish pink intravenously for preeclampsia. Which assessment skin color on the palm of her hands? Which of the fall requires immediate intervention? Option A, blood pressure of 130/90 mmHg. Option B, urine output of 20 ml in past hour. Option C, facial flushing. Option D, patellar reflexes 2+. The correct answer is option C, facial flushing. Facial flushing in a pregnant client receiving magnesium sulfate for preeclampsia can be a sign of magnesium toxicity. Question 2. A nurse is caring for a client who is in the transition phase of labor and reports a pain level of 7 on a scale of 0 to which of the following actions should the nurse take? Option A, instruct the client to use effleurage. Option B, apply counter pressure to the client's sacral. Option C, assist the client with patterned paced breathing. Option D, teach the client the technique of biofeedback. The correct answer is option B, apply counter pressure to the client's sacral. In the transition phase of labor, the contractions are intense and the client may experience significant discomfort and pain. Question 3. A nurse is providing teaching about expected changes during pregnancy to a client who is at 24 weeks of gestation. Which of the following information should the nurse include? Option A. Your stomach will empty rapidly. Option B. You should expect your uterus to double in size. Option C. You should anticipate nasal stuffiness. Option D. Your nipples will become lighter in color. The correct answer is option B. You should expect your uterus to double in size. You should expect your uterus to double in size is the correct information to include when discussing expected changes during pregnancy at 24 weeks of gestation. Question 4. A nurse is caring for a client who is receiving prenatal care and is at her 24-week appointment. Which of the following laboratory tests should the nurse plans to conduct? Option A, Group B strep culture. Option B, 1HR glucose tolerance test. Option C, rubella titer. Option D, blood type and Rh. The correct answer is option D, blood type and Rh. At the 24-week prenatal appointment, it is essential to conduct a blood type and Rh test for the pregnant client. Question 5. A patient has just acknowledged that she is 20 weeks pregnant and confides to the nurse that she has a daily heroin habit. The nurse discusses treatment options for the patient. Which patient statement requires follow-up? Option A. My plan is to visit the outpatient clinic daily for treatment. Option B. Will see my healthcare provider at least every 2 weeks. Option C. My baby will not have to go through withdrawal when I take methadone. Option D. With oral methadone, my baby and I are at decreased risk of infection. The correct answer is option B, will see my healthcare provider at least every 2 weeks. Because seeing the healthcare provider every 2 weeks may not be frequent enough for monitoring a pregnant patient with a heroin habit. Question 6. Many teens wait until the second or even third trimester to seek prenatal care. The nurse should understand that the reasons behind this delay include which of the following? Select all that apply. Option A, continuing to deny the pregnancy. Option B, uncertainty about where to go for care. Option C, lack of realization that they are pregnant. Option D, a desire to gain control over their situation. The correct answer is option A, continuing to deny the pregnancy. Continuing to deny the pregnancy. This is because some teens may struggle to come to terms with their pregnancy and deny it, leading to delays in seeking prenatal care. Question 7. In the male reproductive system, what internal strict standing of transmission? TER secretes fluid into the semen and is responsible. Option A. All of my sons will be affected. In shutting off the urethra at the bladder. Option B. My father had this disease and passed it on to me. Option C. Seminal vesicles. Option D. I have a 50% chance of passing the gene to A. The correct answer is option C. Seminal vesicles. The seminal vesicles are responsible for secreting fluid into the semen during ejaculation. Question 8. A nurse is monitoring a client who has preeclampsia and is receiving magnesium sulfate by continuous 4 infusion. Which of the following findings should the nurse reports to the provider? Option A, blood pressure 148/94 mmHg. Option B, respiratory rate 14 mm. Option C, urinary output 20 ml/hr. Option D, 2+ deep tendon reflexes. The correct answer is option A, blood pressure 148/94 mmHg. Blood pressure 148/94 mmHg. High blood pressure in a client with preeclampsia indicates worsening condition and potential for eclampsia. Question 9. A nurse is assessing a client who is at 37 weeks of gestation. Which of the following statement by the client requires immediate intervention by the nurse? Option A. It burns when I urinate, my feet are really swollen today. Option B. Didn't have lunch today, but I have breakfast this morning. Option C. Have been seeing spot this morning. The correct answer is option D. RN Maternal Newborn Online Practice 2019A. Question 10. A nurse is caring for a client who is receiving an epidural block with an opioid analgesic. The nurse should monitor for which of the following findings as an adverse effect of the medication? Option A. Hypnosis. Option B. Polyuria. Option C. Bilateral crackles. Option D. Hyperglycemia. The correct answer is option C. Bilateral crackles. Bilateral crackles. When a client is receiving an opioid analgesic via an epidural block, a potential adverse effect is respiratory depression, leading to the accumulation of. Question 11. The nurse is seeing a 17-year-old female in the clinic for complaints of acne. The nurse plans on taking advantage of this teachable moment with the teen. Which topics will the nurse include in the teen's teaching plan? Option A. Smoking habits, folic acid intake, and heart disease. Option B. Hyperlipidemia, distracted driving, and menstrual history. Option C. Sexual activity, contraception, and screening for violence. Option D. Optimum weight, hypothyroidism, and sexually transmitted diseases. The correct answer is option D. Optimum weight, hypothyroidism, and sexually transmitted diseases. The most appropriate topics for the nurse to include in the teaching plan for the 17-year-old female with acne are optimum weight, hypothyroidism, and sexually transmitted. Question 12. Which nursing diagnoses may apply to the childbearing family with special needs? Select all that apply. Option A. Risk for spiritual distress. Option B. Risk for injury. Option C. Readiness for enhanced nutrition. Option D. Ineffective breathing pattern. The correct answer is option B. Risk for injury. Risk for injury. This is because families with special needs in childbearing may face unique challenges leading to potential risks of injury, such as physical limitations or. Question 13. A 28-year-old G1P0 client tells the nurse that she medication cabergoline, which is effective in reducing, has a craving for chalk. What is the nurse's best prolactin levels? What are possible side effects of this response to her? Option A. That is not normal for anyone. We need to refer. Option B. Hypotension, you to a therapist. Option C. Nasal congestion. Option D. Tell me more about why you have a craving for it. The correct answer is option D. Tell me more about why you have a craving for it. Step 1. The nurse should engage the client to gather more information about the craving for chalk. Question 14. A mother is learning how to breastfeed her newborn. Shins, moderate variability. The lactation nurse is assisting her with this process. Option A. Baseline FHR 140, occasional variable decelerer. Which technique is correct? Shins, moderate variability. Option B. Have the mother stroke the infant's mouth with. Option C. Baseline FHR 105, no accelerations, recurrent her nipple so the infant will turn toward the variable decelerations, minimal variability, mother's breast for feeding. Option D. Baseline FHR 165, no decelerations, marked. The correct answer is option B. Have the mother stroke the infant's mouth with. Having the mother stroke the infant's mouth with her nipple so the infant will turn toward the mother's breast for feeding is the correct technique when assisting a mother in. Question 15. A patient is trying to learn the cervical mucus detect lung development. Shin natural family planning method. The patient, option A. Risk for dysfunctional gastrointestinal motility, understands that which type of cervical mucus is related to birth before 38 weeks gestation the most fertile. Option B. Activity intolerance related to early gestational age. Option C. Scant. Option D. Purulent. The correct answer is option C. Scant. In the cervical mucus detection natural family planning method, the type of cervical mucus that is related to the most fertile period is commonly described as egg white. Question 16. A nurse is reviewing a laboratory results for a client who is at 33 weeks of gestation and has preeclampsia. Which of the following laboratory results should the nurse report to the provider? Option A. BUN 35 mg/dl. Option B. Hemoglobin 15 mg/dl. Option C. Bilirubin 0.6 mg/dl. Option D. HCT 37%. The correct answer is option A. BUN 35 mg/dl. BUN 35 mg/dl. In preeclampsia, elevated BUN levels indicate impaired kidney function, a serious complication. Question 17. A nurse is caring for a client who is receiving oxytocin to augment labor. The client has an intrauterine pressure catheter and an internal fetal scalp electrode for monitoring. Which of the following is an indication that the nurse should discontinue the infusion? Option A, contraction frequency every 3 minutes. Option B, contraction duration of 100 seconds. Option C, fetal heart rate with moderate. Option D, variability fetal heart rate of 118/min. The correct answer is option B, contraction duration of 100 seconds. Prolonged contractions lasting more than 90 to 120 seconds may reduce placental perfusion and oxygenation to the fetus, leading to fetal distress. Question 18. A nurse is caring for a client who is in labor and has an epidural for pain control. Which of the following clinical effective epidural anesthesia? Option A, polyuria. Option B, hypertension. Option C, pruritus. Option D, dry mouth. The correct answer is option C, pruritus. Epidural anesthesia can result in some common side effects, one of which is pruritus itching. Question 19. A client in her 3rd trimester complains of Braxton. Option A, report any stools that appear to have Milkix contractions. Which of the following intervene occurs immediately to the infant's healthcare shins would help with this type of pain? Select all that provider. Apply. Option B, stools will change from green to yellowish brown. Option C, drink 4 to 6 glasses of water per day, to golden yellow over the next several days. Option D, rest until the contractions subside. The correct answer is option D, rest until the contractions subside. Rest until the contractions subside. During Braxton Hicks contractions, rest can help alleviate the discomfort. Question 20. The nurse is monitoring a client who is 34 weeks guest dividing. Option A, trophoblast or inner cell mass that becomes the fetal monitor tracing are a priority for the nurse to placenta. Option B, embryoblast or inner cell mass that becomes the that apply. Embryo. Option C, baseline FHR 140 accelerations, late decelerations. Option D, morula. The correct answer is option A, trophoblast or inner cell mass that becomes the fetal monitor tracing are a priority for the nurse to placenta. In the context of the question, the nurse is monitoring a 34-week gestation client. Question 21. The nurse is counseling a client on the proper con admitted to the labor and delivery unit complaining sumption of fish and fish products while pregnant, of mild contractions that are 10 minutes apart. How much fish should the nurse instruct the client after performing Leopold's maneuvers, the nurse to eat? Determines that a hard round object is in the uterine. Option A, 8 to 12 ounces of a variety of fish every week fundus. What should the nurse do if green fluid is? Option B, 8 to 12 ounces of a variety of fish every month noted after rupture of the fetal membranes. Option C, 12 to 16 ounces of a variety of fish every week. Observe the fetal monitor for variable decelerations. Option D, 12 to 16 ounces of a variety of fish every month. The correct answer is option C, 12 to 16 ounces of a variety of fish every week. Observe the fetal monitor for variable decelerations. 12 to 16 ounces of a variety of fish every week. Question 22. A nurse is admitting a client who is at 35 weeks of gestation and is experiencing mild vaginal bleeding due to placenta previa. Which of the following actions should the nurse plan to take? Option A, initiate continuous monitoring of the FHR. Option B, administer a dose of betamethasone. Option C, check the cervix for dilation every 8 HR. Option D, request that the provider prescribe misoprostol PRN. The correct answer is option A, initiate continuous monitoring of the FHR. In placenta previa, the placenta partially or completely covers the cervix, which can lead to vaginal bleeding. Question 23. A nurse is assessing a newborn who is 48 hours old and is experiencing opioid withdrawals. Which of the following findings should the nurse expect? Option A, hypotonicity. Option B, moderate tremors of the extremities. Option C, axillary temperature 36.1 degrees Celsius, 96.9 F. Option D, excessive sleeping. The correct answer is option B, moderate tremors of the extremities. Neonatal opioid withdrawal syndrome, also known as neonatal abstinence syndrome, NAS, can occur in newborns who were exposed to opioids in utero. Question 24. A nurse is caring for a client who is in active labor and notes late decelerations in the FRH on the external fetal. Which of the following actions should the nurse take first? Option A, change the client's position. Option B, palpate the uterus to assess for tachycystole. Option C, increase the client's infusion rate. Option D, administer oxygen at 10 L/min via non-rebreather mask. The correct answer is option A, change the client's position. Change the client's position. Late decelerations indicate uteroplacental insufficiency, which can be caused by pressure on the vena cava from the uterus. Question 25. Which statement is the most accurate to make dense about the highest risk group for gonorrhea? To the parents of a newborn during discharge, what is the age range of the clients? Option A, 36 to 45 years. Option B, meconium stools should be expected to resolve. Option C, 14 to 25 years. Option D, 26 to 35 years. The correct answer is option C, 14 to 25 years. The age group of 14 to 25 years is considered the highest risk group for gonorrhea, making it important to discuss this with parents during discharge.